Cancer is a major global health concern, and one of the most powerful tools in combating it is early detection. Many early signs of cancer are subtle and easily overlooked, often mistaken for everyday ailments or stress-related conditions. Recognizing these early warning signs can dramatically influence outcomes, as cancers caught in the initial stages are often far more treatable than those diagnosed later. For example, according to the American Cancer Society, the survival rate for many cancers detected at stage 1 can exceed 90%, but that rate can drop below 20% when the diagnosis is delayed until stage 4. One of the most common and often ignored early symptoms of cancer is persistent fatigue. This isn't the usual tiredness that comes from a busy schedule or a poor night's sleep. It is a deep, unrelenting exhaustion that rest doesn't alleviate. Such fatigue can be an early indicator of blood cancers like leukemia or lymphoma, which disrupt the production of healthy blood cells and impair oxygen transport throughout the body. Additionally, cancers that impact hormone levels or cause internal bleeding, such as colon or stomach cancer, can also lead to chronic fatigue, muscle weakness, or mental confusion. If someone experiences this level of fatigue for an extended period without a clear cause, medical evaluation is essential. Persistent headaches that do not respond to over-the-counter treatments or last for more than 2 weeks can be another red flag. While most headaches are benign, those associated with neurological symptoms such as blurred vision, changes in hearing, or facial drooping may signal the presence of a brain tumor. Brain cancers can cause increased intracranial pressure or disrupt normal brain function, leading to headaches, seizures, or changes in personality. Because these symptoms can be mistakenly attributed to less serious conditions like migraines or stress, they often go unchecked. Persistent headaches with additional neurological symptoms warrant prompt medical evaluation. Changes in bowel or urinary habits can also be indicators of underlying cancers. Long-term constipation, diarrhea, or noticeable shifts in frequency and consistency of bowel movements can be early signs of colorectal or stomach cancers. Similarly, painful urination, frequent urges to urinate, or a weak urine stream can point to issues in the prostate or bladder, which may be due to infection or early-stage cancer. While these symptoms might have benign explanations such as infections or inflammatory bowel disease, their persistence should prompt diagnostic testing to rule out malignancy. Unexplained or persistent pain that doesn't resolve with typical treatments should never be ignored. Cancer-related pain can arise from tumors pressing on nerves or organs, or from internal inflammation and tissue damage. For example, pain in the bones might indicate primary bone cancer or cancer that has metastasized to the skeletal system, such as from the breast or prostate. Abdominal pain can signal cancers of the pancreas, liver, or reproductive organs. In men, testicular or scrotal discomfort might point to testicular cancer, while women experiencing unusual breast pain should consider screening for breast cancer. Pain that grows progressively worse or affects daily functioning is particularly concerning. Mouth sores or lesions that do not heal within a couple of weeks can indicate oral cancer. These might appear as white or red patches, ulcers, or growths on the lips, tongue, or inside the cheeks. Tobacco use and heavy alcohol consumption are significant risk factors. Conditions like leukoplakia, white patches that don't rub off, are considered precancerous and require medical evaluation, especially if accompanied by difficulty swallowing or weight loss. Early detection of oral cancers significantly increases the chances of effective treatment. The presence of blood in urine or stool is a particularly serious symptom. Blood in the stool, whether bright red or dark and tarry, can indicate bleeding from the gastrointestinal tract and may be associated with colorectal cancer, while blood in the urine may suggest bladder or prostate cancer. These symptoms might also be caused by infections or hemorrhoids, but their potential link to cancer necessitates prompt medical evaluation. Diagnostic tools such as colonoscopy, urinalysis, and imaging studies can help identify the underlying cause. Respiratory symptoms like a chronic cough or persistent hoarseness can be signs of cancers in the lungs, throat, or thyroid. A cough that lingers for more than 2 weeks, especially if it is dry, hacking, or produces blood, should be investigated thoroughly. Hoarseness that doesn't improve may indicate tumors affecting the vocal cords or nerves in the neck. These symptoms, often dismissed as colds or allergies, can be early indicators of serious respiratory or endocrine cancers and require a thorough medical workup. Unexplained bruising, especially in unusual locations or without a known cause, may be related to blood cancers like leukemia. These cancers interfere with the production of platelets, which help the blood clot. As a result, individuals may also experience frequent nosebleeds or bleeding gums. In addition to bruising, small purplish red spots called petechiae may appear on the skin, indicating a low platelet count. These hematological signs are crucial in diagnosing cancers affecting the blood and bone marrow and should be evaluated with a complete blood count and additional hematologic testing. Less common but equally important warning signs include eye pain or vision changes, which can point to ocular melanoma, a rare but serious eye cancer. Symptoms such as blurred vision, light flashes, or a dark spot on the iris that changes in size or shape should not be ignored. Regular eye exams are particularly vital for individuals with risk factors, such as fair skin or light-colored eyes. Bone pain that intensifies at night, especially if it's unrelieved by rest or typical medications, can also indicate cancer in or near bone tissue. Subungual melanoma, a rare cancer under the nails, might present as a dark stripe on the nail that evolves in color, size, or shape and can be mistaken for a bruise or fungal infection. Other symptoms such as persistent heartburn, drenching night sweats, unexplained fever, jaundice, and unusual rashes can also signal underlying cancers. Chronic heartburn may indicate esophageal cancer, particularly when it resists standard treatments. Night sweats, especially when accompanied by fever or weight loss, can be signs of lymphoma. Jaundice, or yellowing of the skin and eyes, can occur in pancreatic or liver cancer when tumors obstruct the bile ducts. Leukemia can cause recurrent fevers that lack an obvious cause, driven by the immune system's inflammatory response to abnormal blood cells. Unusual rashes, especially petechiae or other persistent spots, may similarly point to leukemia or other hematologic malignancies. Ultimately, while these signs do not confirm cancer, they do indicate that something in the body may be amiss. Being proactive, recognizing symptoms, seeking timely medical advice, and undergoing appropriate diagnostic testing can lead to earlier detection and significantly better treatment outcomes. It's essential not to dismiss persistent, unexplained changes in your health. Instead, listen to your body, trust your instincts, and consult a healthcare provider when something feels wrong. Cancer doesn't always start with a dramatic symptom. It often whispers before it screams. That's why being aware of the subtle, persistent changes in your body is so important. Fatigue, unusual pain, unexplained weight loss, or a lingering cough might seem minor, but they could be your body's early warning system. Early detection saves lives. Many cancers, when caught early, are treatable and even curable. So if something feels off and it doesn't go away, don't ignore it. Get it checked. Trust your instincts, take action, and encourage your loved ones to do the same. Stay informed, stay proactive, and stay healthy. If you found this video helpful, don't forget to give it a thumbs up, share it with your friends and family, and most importantly, subscribe to the channel for more simple health tips that make a big difference. And while you're at it, tap the notification bell so you never miss out on our latest content. Thanks for watching, and we'll see you in the next video. Stay healthy and keep smiling.